Can GLP-1s make you go blind? This is not a new concern, but it is making all the news headlines again, so let's talk about it again. There is an association, not a definite causation, of GLP-1s with a very rare, horrific eye condition that causes permanent blindness called NAION. This is essentially a stroke to the optic nerve. It's sudden, painless, permanent blindness to one eye that's caused by a reduction in blood flow to the optic nerve. The general incidence is between 2 and 10 per 100,000 people. As a primary care doctor, I've never seen this condition. I've never seen it from GLP-1s or any other cause. I've never seen it. However, some of the eye doctors who see all these rare conditions have noticed more NAION, and so they decided to study it. They did a retrospective study looking at patient records. They looked at over 16,000 patient records, and they looked for people who had at some point been prescribed a GLP-1 medication. And in those people who had received a prescription for a GLP-1 at some point, there was an increased incidence beyond the general incidence of NAION. And so there is an association. However, we don't know that the GLP-1 caused the NAION. Even in this study, they just looked at people who had received a prescription. So we don't know if they had actually taken the medication. We don't know how long they had taken it. Other risk factors for NAION include things like obstructive sleep apnea, cardiovascular disease, diabetes, and obesity. Does this sound familiar? There is some plausibility that GLP-1 medications could increase somebody's risk for NAION. Usually, those who get an NAION have what eye doctors refer to as disc at risk. Their optic nerve is very tight, so they are already prone to having this. And then say that person has untreated sleep apnea where they have apneic spells, and so they're not perfusing their optic nerve, and say they have high blood pressure for which they take their medication at night, which can drop their blood pressure, dropping the perfusion to the optic nerve. And then say we take that person who's already at higher risk because they have the disc at risk, the tight optic nerve, and they may have these other conditions, maybe some medications that can make them prone towards an NAION, and we add a GLP-1 in the mix. GLP-1s can lower blood pressure and decrease the need for as much medication. The big take home from this is that people who are taking a GLP-1 medication, they need ongoing monitoring. Once they are started, they need monitoring of their other conditions and their other medications adjusted appropriately.